the majority of what I end up working with these days are people with depression, mood disorders, anxiety disorders, and then about 30% of my practice is Parkinson's disease. I think it's kind of poetic in my own life is that I'm working with people who are losing their physical capacity. And it fits quite neatly into like this. There's a puzzle piece, obviously, in my life. And I think a great grief around not being able to heal my sister with love, basically, then being out and as an adult in the world and wanting to help people have the best life possible when they are having problems like Parkinson's disease. Multiple sclerosis also is a fairly large part of my practice. And really caring for these folks who are going through significant mental health crises as well.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Deiser. Please remember that the following discussion is for educational purposes only, and is not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Deiser. Thanks so much for tuning in. Today on the show, I spoke with Dr. Pamela Hutchison ND, brain health expert, neurologic disease expert, mental wellness expert, as well as all-around incredible naturopathic physician. Dr. Pam's been in practice for over 20 years with a focus exclusively on neurologic conditions, mental wellness, and complex chronic disease. She owns Acacia Health Clinics in Victoria, BC, and has a team of over 30 practitioners. As an ND student, I had a chance to shadow Dr. Pam for a few days and learned so much from that experience, and I was really grateful for her time. In today's show, she explains her personalized approach to brain health in an actionable, step-by-step manner that I think most of you will resonate with. I really hope you enjoy my episode with Dr. Pamela Hutchison ND. I'm here with Dr. Pamela Hutchison. Hi, Dr. Pamela. How are you today?
I'm good.
Thanks so much for joining the show. We're grateful to have you on Personalized.
Thank you. Thanks for having me. I'm excited to be here.
Awesome. You may not remember too clearly, but you were the only person I ventured outside of Vancouver to shadow when I was a student. You gave me this awesome opportunity where I could leave this city, go to your city, spend a day with you and learn about your practice. And I got a ton out of it. So when we launched this show, I thought, wow, I need to interview Pam because it was so valuable for me. And the key thing that really inspired me was how you had carved out such a niche in your clinical practice and had become such an expert within that niche. And the niche is not super narrow. I think it's quite broad, but it's still a niche. And I'd love to hear what drove you to develop your niche. How did you decide to go all in on this niche? You can explain what the niche is, and then you can tell us.
Sure. Since I was a kid, have been fascinated by all things that had to do with the brain, all things that had to do with, in a sense, how the nervous system worked and all of its mysteries and fascinating qualities. And I got there through a family event that started before I was even born, which was my twin sisters who were born 3.5 years before me. There was an error, unfortunately, in their birth. There's, whether it's a physician error or not, we don't really know. But what happened at that time in this rural hospital in Northern Ontario is that one of my two sisters, the second twin to come out, actually had severe hypoxia. Her placenta had actually come off the side of the uterus long before she was born. And so she was in utero not getting oxygen. And what happened then was that she developed a severe form of cerebral palsy. And then I was born 3.5 years later into this family, a family that was managing a really severe medical concern that involved someone who'd had a really significant brain injury before they even got out into the world.
Wow.
That was the petri dish to what then became my passions in life. I think I witnessed a couple of things as a young kid, and also through listening to my family stories, I learned a lot about how even in a very loving and and warm family, the trauma of having a child that had such great disabilities had an effect on our mental health. And I also became really clear at a really young age how important the brain was. Because if the brain's damaged, obviously I was living with this person with an extremely damaged brain. And the consequences of that were extremely clear to me from a very young age. So when I went into university, I knew that I wanted to be involved in something to do with the mind, something to do with the brain. But when I was looking at the options out there, what concerned me was that I didn't see a lot of things that were supporting people to, there was more like treating symptoms versus supporting people in being as healthy as possible.
Sure.
Watching that be the day-to-day challenge and struggle with my sister was, how do you feed this body that needs specific, given in certain really, really specific ways? How do you actually do the best job? And at that time, back in the 70s, we didn't know what we were doing. By the time I got through university, my undergrad, I realized that I wanted to be helping people, and I wanted to be helping people in a way that would support them to be the healthiest versions of themselves. And I knew from day one that I wanted to work with people with mental health challenges, because in a family with that kind of trauma, there's a lot of mental health challenges that we all went through.
Mm-hmm.
And then also just neurological conditions in general. So all things brain that was pretty broad in that sense, just all things brain, all things
Definitely.
Nervous system. And so I started, even in school, I focused all my kind of free time that I could, as you know, like it's pretty intensive going through naturopathic medical school. But most of the free time I had, I was trying to get better and better at understanding the mind, understanding emotions, understanding the nervous system more broadly and more specifically. And through that time, I came out with my mission, which was, I'm going to basically focus from the very beginning on mental health and neurological conditions.
Wow.
Yeah.
Thank you so much for sharing. Gosh, I did not know that about your sister. Holy.
Yeah.
So, I've been talking to people on the show about, what's inspired me, and really it was hearing about when you're in clinical practice, maybe going back to the child in you and what inspired you as a child. But you started out right away with that, and then built around that, supporting families, mental health, supporting people with brain conditions. Now I know you're supporting people with acute neurological conditions as well, like, for example, in concussion.
Yeah, we do a bit of concussion at Acacia. I would say the majority of what I end up working with these days are people with depression, and mood disorders, anxiety disorders. And then about 30% of my practice is Parkinson's disease.
Is it?
Yes. I think it's kind of poetic in my own life is that I'm working with people who are losing their physical capacity. And it fits quite neatly into like this. There's a puzzle piece, obviously, in my life. And I think a great grief around not being able to heal my sister with love, basically. Then being out and as an adult in the world and wanting to help people have the best life possible when they are having problems like Parkinson's disease. Multiple sclerosis also is a fairly large part of my practice. And really caring for these folks who are going through significant mental health crises as well. Yeah.
Definitely. Can you speak to us a little bit about what the holistic approach might look like when people with these conditions walk into your office? Where do you start?
I start by getting their narrative. The first and most important thing, I think, in the work that we do, which I think is valuable and a bit different from the work that we see with conventional medical doctors, that we're really trying to get somewhat to the root of things as much as possible. And I think part of the root of things, especially in the mental health world, is hearing someone's narrative. I have a phrase that I use a lot, which is the idea that we trust but verify. So we trust that that's the narrative. And then we verify if it makes sense in certain ways, because people will often have parts of their narrative that might be disenfranchising them. And so part of the approach is to trust and really get close to the narrative and then to understand. how we might question some aspects of it that might make for a more fulfilling or more life-affirming interpretation of the life narrative.
Right.
But that's the beginning. And that sounds like a funny place to start, in that, yes, I do a physical exam. Yes, I do these other things. But my first job is always, who is this human in front of me? And I want to know how you ended up in my office. And I want to know what is the goals here? What are we working towards together? And can we achieve that together? And then working towards, building out that plan. But the first step really is to know that human being. And
I love it. I love it.
Yeah.
And I remember that from sitting with you, because I know as an individual myself, I'm like, okay, first thing, I need to know if you have nutrient deficiencies. Like, let's get into objective markers. Let's do this. Let's do that. But you creating space for this person in this way, I think is such an awesome way to start. And I remember that about sitting with you. And sometimes it makes clinical practice quite heavy.
Oh, yeah.
And especially since, we're all driven by our experiences, and your experiences might be considered by some as a bit traumatic, and you may be reliving them or experiencing them in some way quite often when you're meeting people with brain injury. How do you stay present? How do you stay motivated and willing to create that space for people?
Okay, I don't want to sound flaky, but I'm going to say something that could be interpreted that way, so that I try to stay in my heart. I find that for me, and I think this is probably true for a lot of humans out there, closing off actually creates more stress in the end, because it takes energy to close off, and it means that you have to deny parts of yourself. To stay kind of like, if you compartmentalize in a certain way, you will compartmentalize yourself into a tiny little box. And that doesn't work in clinical practice if you want to continue to hear narratives. If you want to continue to work the way that I work, I need to be able to stay in my heart and hear the stories enough, but not become kind of invested into that person's story, like see that as that's their story, it's not my story.
Mm-hmm.
So when I was in school, one of the things I got really fascinated by was Zen Buddhism. And I would go to this Zen Buddhist temple from time to time and sit, and got really into reading about Buddhist practices. And one thing that I think is really helpful for clinicians in general is this practice called Tonglen. And I use it less than I used to, I think because I almost have it on automatic now. But what I used to do very consciously in the room with folks, especially when I was hearing very traumatic narratives, would be to essentially to do the practice of Tonglen, where you breathe in the suffering and you really feel it, and then you give it back to the person. So in the background, doing this almost like a neurological exercise to maintain connection with the feeling and then giving it back to the person was and is a continued way to stay in the room. Like sometimes I think, like, I won't give any details, but I recently had a patient tell me probably one of the top 10 most traumatic histories I've ever heard. Mm-hmm. And the whole time I was being affected. And yet at the same time, I was able to say to her, I can handle this. This is okay. We can get as much of this information as I need for treatment. I also don't really want people to tell me too much of their narrative necessarily, because I don't want them to go too far into their trauma when they're coming in for help. I'm not a therapist, but in order to understand the full nature of this person's significant mood challenge, we needed to understand some of the history here. And so there's the approach of if you can be in the room and stay in your heart. I think the other thing that happens is that the person sees that their experience, their personal experience, is not too much for you. And if it's not too much for you, it helps them see that maybe it's not too much for them. It's a bigger thought that I often have about how we work when we're working with people the way that we do, where we spend more time with them. We're more of a tool in the treatment than the 10-minute visit practitioner. I've seen medical doctors who can do a 10-minute visit and they are part of the medicine. They are brilliant. They can, in 10 minutes, almost like embrace that human being in front of them, see them, give them like a prescription or help them get a lab test done. But also and it's incredible. And I really admire those doctors that can do that. I need more time.
Yeah, me too. Me too.
Yeah.
Oh gosh.
Yeah.
Can you spell it again? Tonglen?
Tonglen is Tonglen. Yeah.
Tonglen.
Yeah. The first time that I was got really aware of the power of it was I'd done this mind-body medicine training at Harvard University it was like a continuing education program. It was really popular back in the early 2000s. And they talked about doing Tonglen a lot. And so there was recordings that I would listen to and get my head around how to do it. But there's tons of resources now out there for practitioners who want to learn it. And it's a practice you do at home too. It's a super good practice for compassion building. It's amazing. Yeah.
Wow. Thank you for that.
Yeah.
I think that, people may see, for example, that they can handle it because you can handle it, but also I think they see that they've got a good team member in front of them when you're able to do that. So much of what you do must be centered around team building and being that person from a clinical side for your patients.
Yeah. I think being a team member, means being like really seeing them as kind of the coach of their own team.
Yeah.
So yes, but I do think that it's helpful to be deeply collaborative. And I do think that you really get there with time and listening and hearing the story. And then once we have that understanding, just to say this, like there are folks where the narrative is pretty straightforward and they don't really have much need to go into it. And that is also absolutely fine. I have many patients where I would say that the approach to care is more lightly held. And then there are people where it's more intensely held. And both's fine.
For sure.
I can handle either. I think that the big thing about patient-centered care is that we keep that human in the center of care, and in the way that we do that is A, by knowing who they are, but B, also by then through knowing how they are, like crafting the plan together. So we're not dictating it from above. It's an art of, I think, conversation and keeping all the tools on the table, but being able to articulate those tools in a way that gives people, the insights to make the choices that they need to make to change their health. Yeah.
Definitely. And putting them in the coach's position. I like that. I like the way you framed it. Now we've set the scene. We've got the narrative. Can you speak to us about a few clinical pearls, or maybe dive into a bit of personalization, individualization that you might utilize in someone, for example, who has Parkinson's? The space is created. What's next in your repertoire? Can you share some tools with us?
Well, I think when it comes to people with neurodegenerative diseases, one of the things we have to get really clear is where are they on the arc of the journey of that disease. That's one of the steps to personalizing, is to know what stage is this person at. So someone who comes in with Parkinson's disease and they are falling and shuffling gait have a very different starting point than the person who just got diagnosed. We have different possibilities of care in those two different groups. So that's one piece, is just understanding that,
definitely
who they are, their narrative, and then also where they are in their narrative of their condition. I am a very big fan of basic blood tests for what I would say are kind of the usual in my world. And the usual in my world ends up being pretty standard stuff, but I'm looking to see, how is this person doing nutritionally? I really want to know what their status is for some of the critical nutrients that we can test for. So that might be iron, ferritin, B12. I of course want to know their B6 levels if they have Parkinson's. I want to know if they are having problems with elevated levels of certain markers for inflammation, like CRP is my favorite one because there's the most research to support its use in Parkinson's patients. And then things like homocysteine, which are important predictors for certain types of outcomes. And then also looking at their metabolic health. And really doing it again through the things like hemoglobin A1C, looking at fasting insulin, fasting glucose. So when I'm working with someone with a neurodegenerative condition, what I'm looking for is, how are you now? We know this progresses. What are the things that are off for you that we know predict progression, faster progression? So that's one of the tools, is getting a good set of blood tests done. I'm a big fan of the diet journal.
Yes.
I see sometimes there being this movement away from it. And I think it has huge limitations, of course. Like as soon as you open the box of Diet Journal, people change their diets a little bit, right? When they're recording their diets, because they want to look maybe like they're eating a little better than they thought they were, or they, it's always a mishmash. But it's a starting point for understanding what is as best we can. We're never going to get perfect on something like that. And I do see that, particularly looking at neurodegenerative diseases, the general understanding now is that they're largely metabolic illnesses with neurological consequences. And so this is where naturopaths become really important, because that is smack dab in the middle of our strengths. We can really change people's metabolic health. We understand how to change microbiome, how to change people's metabolism over time through the things that work best, which are the basics. Like when you start looking at what works best for changing someone's metabolism and what level of inflammation they have in their body, it's the basics.
It's the basics.
It's the basics.
And the funny thing is, in my experience in neurodegenerative disease, is people haven't had this conversation before. Or they've been offered a medication or not.
Yeah.
And that's about it. And then they show up and it's like, okay, what's next?
Yeah.
But I love this, assessing inflammation and glucose control.
Yeah. Like if you think about some of the bigger predictors for progression in Parkinson's disease, they are literally like being inactive is a predictor of Parkinson's disease. Eating a lot of fried foods is a predictor for progression in Parkinson's disease. Having elevated inflammatory markers is a predictor of progression. Having a high hemoglobin A1C, so having insulin resistance or actually having diabetes, that correlates with faster progression. A low vitamin D level, faster progression. So the things that we do and test for are smack dab what people, especially people with Parkinson's, who often show up in a naturopathic office early in their disease. Same with people with MS. They often show up really early, right after diagnosis. And it's the best time to come see a naturopath, because that's where our tools around, helping people improve their metabolic health and their neurological health are best used early and often.
Right.
Yeah.
Well, I like the framework you've given, because as a clinician, when someone walks in with Parkinson's, I get a bit nervous.
Oh, yeah.
I feel like I need to be the most advanced person they've ever met.
Yeah.
And then going back to the roots and thinking holistically can be a bit stressful, because it sounds a bit simple, but no one's done it for them yet.
No one has. And I think we underestimate as naturopathic physicians how hard it is for people to make the fundamental changes we ask them to make.
Yeah.
And that we, just as like they are coaches to their team of healthcare providers, we need to be like kind of coach back at them in the sense, like we need to help them stay on track. Because like lifestyle changes that make the knock-on benefits for people. Like let's just talk about leafy greens for a moment. Like I'm obsessed with leafy greens because of their effect on people's brains. It's unbelievable what you get from a serving and a half of leafy greens daily when you do that over time.
Right.
Like we see in the research that the cognitive age difference between the people that do that and the people that don't is 11 years over time.
Seriously?
It is. So like if there was a pill like that, everybody'd be taking it, but it's greens, it's leafy greens. And it's not a green supplement, it's leafy greens, it's eating leafy greens.
Sure.
And so keeping that up, if you hate it, having the tools of like all the tricks of the trades that we can say, well, this is one way you could do it. This is another way you could sneak it in. Here's another idea. Or even just being able to say, look, this is the data. Yeah. So we got to figure this out and motivate people. These are the things that you don't get in a 10-minute visit. And honestly, it's not fair to expect the neurologist to do it.
Mm-hmm.
Because that's not their job. Their job is to really get a good sense of the diagnosis and help with managing, and largely through medication and surgery, right? Mm-hmm. Like their job is really clear, and it's a big, hard job. And we can be there as naturopathic physicians to back them up.
Definitely.
Yeah.
Can you speak to the exercise component a little bit? for this from this lifestyle? Because we know that there's obviously value in glucose control, but exercise, so much of it depends on where in the spectrum of this neurological condition they are in Parkinson's. Can you give me some tools, some suggestions that we might have? I'm being very selfish because I've got like 3 people that I'm working with and I don't know how to program their exercise.
Yeah.
Can you give me some ideas?
Well, so we know that there's certain types of exercise that have bigger effect sizes on slowing progression. And as I say this, I'm abundantly aware that there's just been something published on exercise that I haven't read yet. And one of my nerd crushes, Dr. Michael Kuhn, he's a movement disorder specialist. He just posted it on his Instagram and I'm like last week, and I'm like, oh, I got to read that because it's a bit more specific about what works and what doesn't in terms of these, like in really large studies. So
still a good resource. Let me stop you. What's the name again?
Michael Kuhn is he's the neurologist, and he posted on his Instagram a study that I don't think he was involved with, but that is a review of all of the exercise studies that have been done to help inform movement disorder specialists on what how you should be recommending exercise. And I don't even have the name of that study for you right now.
That's
I just am abundantly aware it's out there, and I don't want to
No, but awesome. Now give me yours.
Okay. So it's things that you already know. So the most important thing is, again, what do they love? We got to get them moving, period. And so finding out what they love, because we know they'll do it. They're not going to go to the gym if they hate it. They might go for 2 weeks and then they're going to be like, I hate it. I can't stand it. It hurts my heart to go into that space.
Sure.
So they're not going to do it. They're not going to do it. So finding what they love and being really open. It's like, again, all tools on the table, so that could be dancing with their grandchildren, having dance parties with their grandchildren could be the thing, right? But we want them to be getting a volume first. Mm-hmm. So I focus on volume. Volume meaning minutes doing moderate to vigorous activity. You got to keep in mind that some of them are balance challenged. Hopefully, if you've done a workup and you're not sure about that, you can do a pull test and be sure, know where they are on the balance spectrum. But if they have a good balance, and then usually at the beginning they do, then you have quite a lot of options out there. And cycling, riding a bike is a really good one for people with Parkinson's. Mm-hmm. The best performing exercise in terms of people, let's call them the positive deviants that are doing the best in slowing their progression. Mm-hmm. Those folks are running. So running is running, and running it, the more the better. So we know that they need to have more than 2 days a week of aerobic exercise to start to move the needle on progression. So the first 2 days, in a sense, don't count. Like if you don't do any more than 2, then you're actually not moving the needle. You've got to be doing more than 2 days a week. So 3 days, 4 days, 5 days, and there's a dose-dependent curve on that. So I want them to think of themselves as new athletes. They're going to find a physio to help them when they get their injuries. They are going to get on top of stuff, right? So the first job that I focus on is, let's just get the volume up. Doing something you love. If it's outdoors, bonus points. If it's social, bonus points. If it's outdoor and social, you just won 30 million gold stars from me, because that's amazing. We want them to be doing stuff that they're stacking as many wins as possible onto whatever effort they put in, because they only have so much energy in a day. So that's the beginning, and tacking towards things like cycling and running if possible, because that does seem to be a bit better for outcomes. But another great outcome is dance. And dance classes. Dance has the music, it has social exposure, it's got balance training in it. So dance is a good one for folks with Parkinson's. And for some people, that's more joyous and where they're going to get their, the reward that we need them to get rewards. And remembering these folks are dopamine challenged, right? So their reward system isn't working as well as it used to.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Gosh, that's good insight. So like, I never thought about the dance. It sounds so easy and rational, but it's not something I considered. And I bet a lot of people would benefit from that, even people who hadn't tried dance before. I bet that would be something interesting and fun to do.
Yeah. And what I find is so interesting is that they already know what's going to be the best thing for them to start with. And, I'm going into this with like, this person has a neurological disorder that we want to slow down. And they're really motivated, right? So these folks are super motivated from the perspective of delaying progression, especially when I'm seeing them early. And so I know that that's very different from other folks that people see out there who also need to exercise. Like we want all humans to get that volume, 150 minutes, like at least, right, of exercise and of moderate to vigorous activity every week at least. But the motivation factor when people see a horizon of disability coming at them is so different. And so there's like, they want to do it. And sometimes, you still want to work on that reward system, but sometimes the getting rolling can be a little easier working with folks with Parkinson's because they want to do it. The other thing too is that we can't forget that they need balance training.
Right.
So there's a concept called prehab that I love. I'm loving this concept.
Okay.
And I countered it at the World Parkinson's Congress I was at in the summer. And a physiotherapist was presenting on exercise and he was talking about prehab. And I was like, prehab, that's so interesting. That's like a new word I hadn't heard. And the idea is that if you have someone who has Parkinson's and they're going to eventually have these problems, a set of problems around balance particularly, but shuffling of gait, all these other things, as soon as they're diagnosed, that's when we start to work the systems that we know get weak in the future. And that's where balance becomes a really important piece, because the more that we work folks' balance centers and challenge them and poke at them and say, you need to still be good at this, you need to still be good at this, the slower they'll lose it. Because that's one of the big risks with people with Parkinson's. Like they don't necessarily die from Parkinson's, they die from the consequences of things like falls,
right,
or respiratory weakness and the inability to clear their secretions in their lungs. They die from things that are, they are adjacent to the disease, but they're not like because they can't move.
Yeah, sure.
Yeah.
Do you have a prehab protocol? Do you have a standard balance training protocol that you give?
I don't, because again, I am a big fan of passing certain jobs to experts that I tell them, I get them to be seeing a physio. And then I'm like, you need to have your physio get you balance training, and then let the physio see where their weaknesses are and where their strengths are and work on it.
And individualize it, personalize.
Yeah. And then my job is just to check in and go, how's that balance training going?
Definitely.
And checking in on those things. But I don't see myself as the person to give them that, because where I work, we have physios, we have a whole host of healthcare professionals. And in Victoria, we also have a couple amazing clinics with some additionally just incredibly talented physios. And so I send them out for the specifics around that. I'm just saying we need to find some balance training. And as soon as it gets easy, you got to change it.
Okay.
Yeah. Once it's
Keep
easy,
it up.
you're not learning anymore, right? So they need to keep making it challenging. And that's just outside of my wheelhouse. I don't have enough contact with them to do that kind of balance training work.
Definitely. Well, speaking of learning, I know you've been doing this for a very long time, and you're considered a pro in our profession. And I'm wondering, along the journey, what have you had to learn the hard way? Has there been anything that's really forced you into a scenario where you had to learn something in say, a more challenging way than typical?
Oh my gosh, how much time do you have?
For sure. I know, right?
Yeah, no, but there's a lot of stuff that I think, in life, I've learned the hard way. I think one of the things that I feel really strongly about, and I learned this the hard way, is that we need to keep all the tools on the table for patients. I think like back in the 90s when I went through school, there was different approaches to the way that people were taught than maybe they are now. So I can't speak to how it is now. But at the time there was a approach to being trained that was a bit othering of the traditional medical system, and created maybe a lot of villains out of things that are life-saving or life-changing. So, antibiotics were bad, or anti-inflammatory medicines like steroids were bad. And I have done a complete 180 on a lot of that. I would say that we're, through watching people really be afraid of Western medicine and really being afraid of things that would be honestly life-changing, life-supporting, and things that we as naturopathic doctors could support them while they're doing. And especially working in the world of mental health, I really saw a lot of what I would consider either unnecessary or unfounded fears around certain aspects of care, and people suffering unnecessarily. And I think at this stage of the game, I just don't want to continue narratives out there that limit people's therapeutic options. I don't think that's helpful. I don't think we as naturopathic doctors do our profession or do patients any service when we start pulling things off the table and vilifying approaches to care. There's going to be approaches to care that have more harm attached to them. We know that. That is, that's just a fact of working with people. There are risks to what we do that might have to do with delay of care. I remember one of the first times I was thinking about this was I was working with a patient with severe depression, and I was starting to think, this is not, like, everything we've tried has not worked. And I started wondering, I wonder if the delay in accessing other types of care is a harm. It was I was fairly early in my practice, but I was thinking about it. And then later found that there's evidence to support that delay in treatment of depression does actually make it harder to treat depression. So in my own practice, I set new sort of rules around, we need to see, if we don't see, through conversation with patients, not rules but if we don't see,
not dogmatic, individual,
not dogmatic, but that, look, this is what the evidence shows, and we need to see some movement on this, or we need to move to something new. You can't just let this sit for a really long time.
Definitely.
Yeah.
Well, as an active member and a longstanding member of the academic committee for North America's largest naturopathic institution, I can assure you that the education is different now.
Good.
But I think what you're speaking to, really, keeping an open mind in clinical practice, right? Like, you might enter thinking you're going to be practicing one way. I know you had your niche set, but maybe your style evolves over time through extra learnings and courses and just keeping an open mind and experiencing what it's like to sit with patients all day long, every day. That reminds me about the fact that you've taken extra training in amino acids. So I've got a deep interest in amino acids, and I'd love to hear if you have some special approach to amino acid therapy in neurologic disease, or assessment tool, or anything you can share about it that we could learn from.
Yeah, there's been a lot of assessment tools that I've cycled through, looking and hoping for there to be something that would help you read the tea leaves of what would work for someone. In my experience, there isn't anything at this point that is a reliable test that is something that gives us a window into what's happening metabolically for that person. And a lot of the training that I did was around certain types of testing and approaches to care that were well reasoned, made complete sense. But then when you start working with it, seeing that there's some real problems with the use of those things. And so my approach I feel like I'm the naturopath that's gone back to the basics many times over again, but my approach is trial and error, honestly.
Yeah.
With like an educated guess, right? So, we're not going to, if someone is coming in with depression and they're highly anxious, we're not going to jump to providing them with high loads of tyrosine. That's silly. We're obviously going to go for things that are more likely to feed the neurotransmitter pathways that are more on the rest relax side of things, instead of, ending up at noradrenaline. So,
definitely.
Yeah. So we want to be logical in our approach to things. But the actual assessment tool there is your clinical history taking, in my opinion.
Well, I think what you've done there is given us all a bit of freedom to do the trial and error, because that can be quite nerve-wracking, right? For a clinician wanting to increase one level of amino acid, it can be difficult to make that decision.
Yeah. And you need to be patient. So I think one of the things that it's another one of those hard learned things is that learning the rate of change in a human being, how an intervention, what can you expect from an intervention is really like, it's specific to the intervention. So you can't expect certain interventions to really show their full effect for maybe 3 months. And other things like, that if you give someone a certain herb, they should calm down within 20, 30 minutes of that. They should feel it. So understanding that rate of change is really critical. But in the world of amino acids, I think it's still pretty hard for us to say what's the expected rate of change in individuals. And so we do need to have a bit on the air on the side of patience, which is, again, this is the art, right? Because if you're working with someone with depression, you need to meet with them regularly and understand what's happening and be able to say, look, we got to pull the parachute here, try something different because the amino acids aren't working. And at the same time, you're trying to figure out, have we given it long enough of a trial? This is the art of care, right? Because it's not an easily understood thing yet out there in the research.
Yeah, no, thank you for that. It's valuable still. I'd like to shift gears a little bit because you're inspiring to me in the sense that you have this really cool practice that you built. Not only is it beautiful, but you have 2 clinics and you have 30 practitioners. Yeah. What's it like owning a practice with 30 practitioners?
Well, it's a lot of things. It's deeply rewarding. I feel a huge amount of love towards the team members that we have at Acacia. They are like front end staff bring their hearts every day to work. The clinicians bring their hearts and everybody brings their hearts and minds, but the clinicians do an incredible amount of good work here at Acacia. It's kind of like I think I have always been someone who really wants a warm, loving community around me. And so it's kind of like having a warm, loving community around that I happen to own the space and own the systems and everything that have created it. But it's pretty humbling. I have to say, it's a lot of work. It's a lot of thinking. It's a lot of human management. And fortunately, I've always been fascinated by humans and I love humans. And I think humans are the coolest beings out there. But, there are times where you have to do really hard things, right? It's a balance. So what's it like? I mean, it's everything.
It's a whole bunch of things.
It's everything.
Last time we spoke, you gave me really good organizational management tips. And this time I need to ask you about recruitment. So
this is the big question right now, isn't it?
Well, probably.
Yeah.
How have you built such a big and seemingly a team that you love so much? What's been your key recruitment tool? Not only, maybe let's focus on the practitioner side. How do you find good people and inspire them to be a part of your practice?
One of the things we do is we hire slow. I have spent my entire career watching businesses take off really fast and always been like, wow, that's amazing. I don't know how they do that because I go slow.
Yeah.
So I build slow and I'm very good at sustaining and holding off gratification. I've always been really good at it. I think that was one of the things I learned from having a sister with such a severe health problem was that it'll come. You just got to wait, mom's busy. So
right,
just wait. So I got really good at waiting and really good at watching. And I think I still am that human. And so we take our time when we're hiring people. The clinic director at the site that does all the phys med, he always says to folks, he says, we're hiring when we find the right person. Because people are like, when are you hiring? When do you want me to start? We're like, well, you're going to start when we find the right person. So if that's you, we'll start with you.
Mm-hmm.
And so that sometimes means that you take financial risk, you wait. But I have over time, over and over again, learned that if you hire the wrong person, the downside is far bigger than the wait.
Mm-hmm.
So bringing people onto the team means, you're waiting to find good people, but also you are unfortunately getting rid of people, not getting rid of, but ending relationships, or at least ending the employment relationships with people who are not fitting the team values early.
Mm-hmm. Early.
Yeah, early. So it's the old adage you see in a lot of management discussions around like that you hire slow and you fire fast.
Yes.
But I think that like as a leader, you want to be seen as making those hard decisions for the betterment of everybody. It gives people a sense of trust. And I have found that the delay is a great way to degrade people's faith in me. I've seen myself degrade people's faith in me a few times, and it's hard and painful. Mm-hmm. And a lot of times it's been because I've made a bad decision, or I've just moved too slow on something that had to do with caretaking for the team. The other thing that I think is really important is that the culture of your clinic is maybe the most important thing that you focus on every day, because the culture of the clinic is what attracts people to you. Mm-hmm. Especially around the pandemic, we really learned really quick how important culture is. And there were things that happened during the pandemic that were really hard for me and for Acacia. And I came out of that learning how important it was for me to be available, be in contact with people, and for the culture to be really front and center and to stay on top of it and be aware of it and know what's going on and how people are feeling from day to day. I've always wanted people to come to Acacia to work feeling that they belong and that they don't have to think about, the politics or the dynamics of work, that they can just come and be supported, do their best work for their patients. I truly believe that when people, and I know there's data to support this too, so this is another place I like to nerd out on, but the whole idea that it's just up to that clinician to make a difference for the patient is so wrong. It is not just on you. It is that patient's experience from the second they walk into your clinic makes a difference in their outcomes at the end. Doesn't matter whether you're us as naturopathic physicians, you're a clinical counselor like we have, physiotherapist, massage therapist. The patient's experience includes the clinic and the staff. And if you walk in and someone knows your name and they say, have a cup of tea, which is what we do.
Yes.
Wishes you a happy birthday, it's your birthday, or asks you about your dog, you belong. Mm-hmm. You're safe. Then you go get your massage.
Yeah.
So you got your massage in a safe place.
Right.
That's different than if you come in, it's cold and icky. And to me, that's another element to attaining a team and then keeping a team is the culture. And when you focus on that, the team's happier. Like people enjoy working at Acacia, I hope. I love working at Acacia myself.
Surveys are good.
But the other thing is that the patients do better.
Yeah.
So there's no loss. Like there's no downside to focusing on culture. And I'm involved in a coaching group for business owners. And one of the things that they talk about, for clinic owners, and one thing they talk about is that culture eats, what do they say? It's culture eats systems for breakfast or something like that. Like if there was one thing that you focus on, it's got to be culture. Culture will also end up being marketing for you. Mm-hmm. Mm-hmm. But it's a long game, right? So it's when people are like out there, I need to hire like 3 people, I like a lot of people right now, they're losing their front end staffs and having to like hire and rotate through front end staff. I've seen this a few times. Me saying culture doesn't like it. It's kind of like, oh yeah, okay, that's great, but I need someone tomorrow.
For sure. Sure. Yeah.
But I think like if you can tolerate hiring slow, even in a high pressure environment, you win in the end. But it's just that, how are you going to take care of yourself and your family while you're doing that? It's a challenge.
It really is. It really is. But you're doing really well. And thank you for the discussion on culture. I think it's incredibly important. And I'm taking courses on clinic development, and we speak about culture a lot, of course. One of the frameworks that I'm trying to use is balancing and speaking about and promoting both solidarity and agency in practice. So we're moving together in the same direction. We have the same goals for our patients, but also we have agency over our own clinical practice. We can practice in whatever way suits us. And so having the bit of duality there has been really helpful for us, because we all practice a little bit different. Yeah. But we have to have that common goal. And before even talking about that, we weren't thinking about it. We were just going about our business, and just speaking about that, maybe even once, starts to build the roots of culture for us. Yeah.
That's so interesting, because there is this aspect to, once things have been said in a space, it changes the whole space.
It does.
And you also get a recognition and appreciation for how much you share. I find that that's a really rewarding thing about clinic ownership is seeing how much people are pulling together. And sometimes you kind of forget it. And then you get this moment where you're like, oh, wow, look at that. Look at us go.
Yeah.
Wow.
I love it.
Yeah, it's cool.
Love it. Love it. Well, I'd like to end us with something in the realm of personalization, in the spirit of individuality and personalization. Share with us something that most people don't know about you.
Most people. I'm obsessed with crows.
Oh my gosh, I knew it. I got a hot tip, by the way, from one of your colleagues. And I was going to say this, that you have pet crows. I
do. I would call them pets. I would call them neighbors that they formed a close and loving bond. Primo and Ginger are a mated pair that live in my neighborhood, and I wooed them over 2 years. Again, the long game.
Yes.
With Peanuts. And right now we're in the middle of a reno, so I'm not seeing them as much, and it's actually breaking my heart.
Oh my goodness, no.
I miss them. But this couple, they bring their babies during once the babies are actually out, they bring them, we feed them, they hang out. Primo will come and hang out with me quite a bit. He's very social, and he'll hang out and just sit above me and watch what I'm doing. He's fat. He's as interested in me as I am in
For
him.
sure.
But one of the things that it treated for me, being in touch with crows, was this deep grief I feel inside of me around the fracture with nature. I feel it very intensively for some reason. I don't know if other people do, but for me, I feel like there's this deep fracture that we have as humans with nature. And to have even, 2 mated crows know me and they'll follow me sometimes when I walk through the neighborhood or I go for my runs. They'll be like, oh, we'll follow you to that post, but then we're out of our territory. We're not going any further. And I know that. I know their territory. All of that gives me a break from that deep sense of grief that we're not connected to the universe the way I think we're supposed to be.
Yeah, right. Yeah. Well, thank you for sharing it. It resonates with me because my wife and kids have a little friend named Hoppy, but Hoppy's a single crow. It's a bit Hoppy. It's a bit of a more sad story. There's no babies. Yeah, I know. Hoppy needs to get out there big time, but they've got a steady diet of peanuts too, and that's been great for my kids, I think.
It's so good for kids to see that. It's so good.
Yeah. Well, listen, Pam, thanks so much for your time. I mean, this was an excellent conversation. I really appreciate coming on Personalized. Thank you so much.
Oh, thank you for having me.
Before you go, how can people reach out? How can people connect with you, whether it be on social media or through your clinic?
Well, so they can reach our clinic at office@acaciahealth.ca or on the website at acaciahealth.ca. They can reach out to me. I'm Dr. Pamela Hutchison ND on Instagram. That's probably the best way to reach me. I also have a podcast, The Well-Nurtured Brain, and they're welcome to listen to that. That is on everywhere you get podcasts.
Excellent. Thank you so much. I really appreciate your time. Have a great day.
Great. Thank you.
See you.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.